First, I'd like to introduce you to Charles Patterson of the Clark County Combined Health District. Charlie has been Clark County Health Commissioner for the past 20 years. He has more than 31 years of public health experience at the state and the local level. So Charlie, thank you very, very much for joining us.
Thank you, Governor DeWine.
Let me just maybe look a little bit at Clark County, and maybe if you could just kind of tell us how this has evolved, maybe going back to at least when we started the color code, and kind of tell us what the evolution has been and maybe where you are today.
Well, we started with the orange color code. After about 2 weeks, we moved up. We had a few weeks of red, back to orange, and then last week, due to our current circumstances, we're back at the red hazard level. We started basically with businesses and employers, especially those essential employees that had to go to work every day. As the schools were closed and many other businesses were, these folks weren't allowed to stay home. And so they passed that along, and several large outbreaks, including at Dole. We had some outbreaks in manufacturing and warehousing in Madison County that affected our community as well. At this point, we're seeing it in the general population, and unfortunately, that now is starting to affect our nursing homes. And the one way we're knowing that it's affecting the nursing homes is because the National Guard testing that's going on, it's a phenomenal program. We're seeing the employees tested every 2 weeks. Unfortunately, with that testing, we are starting to find the indicators of employees and now residents at our long-term care facilities being affected.
So in your case, you were actually seeing kind of community spread then move into the nursing homes. Is that kind of the
Absolutely. We had we were seeing 55 cases a week or so, and now that's moved into the nursing home long-term care. That's bumped us up to more like 75 to 80 cases a week now, with those residents and employees being affected. And
talk to us a little bit, Commissioner, about the start of school. Clark County, you have kind of, some schools are remote, I think, and some are in person, maybe some are hybrid. How do you handle that, or what do you see going forward? Because I know that, you know, the partnership between you and the superintendents, you and the schools, is a very, very important partnership as schools start back up.
Well, we do have a great partnership with our superintendents, but as you know, local control is very important in Ohio, and local school boards have chosen the entire gamut here in Clark County. We have a couple of districts that are fully remote. We have a couple of districts that are doing the hybrid, and a couple that are going back to school full time. Each of those districts has a plan in place to try to keep those students and teachers in school as long as possible, and we'll be very closely monitoring that here in Clark County to make sure we can keep those schools open. One of the things that we have to be very careful, though, is personal responsibility of all of our citizens, because just as we've seen it affect our long-term cares, we know that if people are not following your guidance with the social distancing and the masking, we very quickly could see this transmission in the schools, and then we'll have to work closely with the superintendents that are in person to see if we can continue that.
How are we doing in Clark County in regard to social distancing and wearing masks out in public? Do you have any anecdotal, what you have seen, maybe what your health department's seen?
Well, we've certainly seen a lot more masks on individuals since your mandatory mask order. But I would tell you that the number of complaints we're getting has also risen because of that. People want to go to a store, they want to go to a place of business and feel safe, and they only feel safe if everybody's wearing masks. So we still have enough people not following the guidance that's throwing our numbers off, and that's why we continue to battle this in our community.
Maybe a last question, if we could go back to the schools for a moment. Just as the nursing homes many times will reflect, you know, the community spread, certainly schools are going to and do, those that are open now, reflect the community spread. What's the procedure? What's the procedure a school follows if, let's say that, you know, they have some indication they have a student who has some of the symptoms?
Well, the first thing that will happen is the contact tracers at the health department will work with the school districts. We have designated people at each of the school districts that we'll be sharing information with. The school nurses are very vital to this effort moving forward. And we'll look at seating charts. We'll see exactly who has spent that less than 15 minutes or more than 15 minutes, less than 6 feet away. And those individuals who surround a positive case will be quarantined. The positive cases will be isolated. And we won't look at an entire class. If we can, we'll leave as many kids in place as we can. But those individuals who are affected, we are going to have to make sure we stop the spread by that quarantine order.
Well, Commissioner, thank you very much, not just for being here today, but thank you for what you do to keep Clark County, the citizens of Clark County, safe. And we want to thank not only you, but your whole team. You've got a great team there, and we just appreciate, we know you guys are working really, really hard, and this is, there's no let up in this. So thank you for what you do.
Thanks for acknowledging the team, Governor. They're doing yeoman's job out there.
They are indeed. Thank you. Thanks a lot, Commissioner.